Hey guys, I'm Dr. Gonzalez and welcome to another video. Today we are discussing the following topics. And you know what? Let's just go ahead and get started. The respiratory system brings oxygen into your bloodstream from which it can be transported to all of your body cells and tissues. So this process of providing cells with oxygen, it's also known as respiration. And in this process, we also remove waste product like carbon dioxide from the blood, and it can channel it, your body can channel it outside the body. So because of this, we will have these structures that are part of the upper respiratory system and structures that are part of the lower respiratory system. So the structures that you're going to be finding in the upper respiratory tract or system include the nose and nasal cavity. You're also going to have the pharynx and the larynx. As part of the lower respiratory tract or system, then you're going to find the trachea and the lungs. The pharynx, it's also known as the throat, and it consists of three segments. We have the nasal pharynx, which is also the posterior part on the nasal cavity. We have the oropharynx, which is located posteriorly to the oral cavity. And we have the laryngopharynx. And the oropharynx and also the laryngopharynx are also digestive system structures and are connected to the oral cavity and the esophagus. Hey guys, I'm gonna make a quick stop right now so that you can like this video, because that will really help me with the YouTube algorithm to spread the word to other students and health professionals like yourselves. And also subscribe if you're enjoying this channel and this video. All right, let's continue. The skeletal framework of the larynx consists of cartilages connected by membranes, but in general, the larynx is also known as the voice box. In here, we're going to find several cartilages, such as the thyroid cartilage, which is the largest of all of these three anterior wall cartilages, and it's also commonly known as the Adam's apple. There's also the cricoid cartilages, and posteriorly, we have the epiglottis, which is a structure that serves as a flap that closes over the glottis, the opening into the larynx during swallowing. And then, of course, we have the vestibular folds and vocal folds, which are the true vocal cords. The airways branching from the trachea form the bronchial tree. So from here we have the primary bronchi. Actually, these are divided into right and left primary bronchus. Then we have the secondary bronchi, also known as lobar bronchi. We also have the tertiary bronchus, also known as segmental bronchus. And then we have the bronchioles. These bronchioles will work to become a smaller branch known as terminal bronchioles, which subdivide to form respiratory bronchioles. And from there, we will find or divide into alveolar sacs and alveolar ducts. And then, of course, the smaller alveoli, which is the area for main gas exchange. Here is the bronchial tree histology, and if you want to take a look at this, you can feel free to pause the video now. Now let's take a look at the actual lungs. The lungs are divided into a right and left lung, and these are covered by a thin serous membrane called the pleura, and they're located in the pleural cavity. So the right lung, which is what we're looking at right now, it's divided by connective tissue into three lobes. We have a superior lobe, a middle lobe, and an inferior lobe. And these are divided by the horizontal fissure and an oblique fissure. We also can find the apex, which is the very tip of this lung right here. And we can find the base, which is this portion right here. The left lung, it's made up of two lobes, a superior lobe and an inferior lobe, divided by the oblique fissure. which is the reason why the left lung is smaller in size in comparison to the right lung. There's also an area, both of them have this structure called the hilum, which is a common passage of the bronchi, pulmonary veins and arteries, and lymphatic vessels. Now, in the left lung, we can also find this area right here is known as the cardiac notch, which is a concave surface that allows the space for the apex of the heart. The respiratory system brings inhaled air within close proximity to your bloodstream, where the exchange of gases is going to occur. So the whole process involves 3 steps. So before we get started, let's go over what's inhalation versus exhalation. So inhalation or inspiration, it's when the air moves from the outside environment to the tiny alveolar within the lungs. So we're going from outside to the inside, and it goes into this area right here. Now in exhalation, so exhaling air results when the respiratory muscles relax, and so we can push that air outside. And so the together process of inspiration and expiration, it's known as pulmonary ventilation, which is item number 1 here. Due to the pressure differences, oxygen moves out of the alveoli and into the capillaries, and carbon dioxide moves in the opposite direction. This process right here, it's known as the external respiration. And the third step of respiration is known as internal respiration, that it occurs when oxygen carried in the bloodstream diffuses into the surrounding body cells, and carbon dioxide moves from the cells into the bloodstream. Now, the movement of air is the result of changes in air pressure, which occurs when the lung volume increases and decreases. So this is in accordance with the Boyle's law, which you have right here, which states that the pressure of gas within a closed container, it's inversely proportional to the volume of the same container. In other words, increasing the volume of a closed container will decrease the pressure exerted by gas molecules inside it. So the process that enables us to increase or decrease this volume is the skeletal muscle contraction and relaxation. So here we have some of those muscles, but normal inhalation is caused by contraction of the respiratory muscles, and the main contributor, it's the diaphragm, which is this muscle you're looking at right now, which increases the volume of the thoracic cavity when it contracts. We also have the external intercostals that participate by elevating the ribs, which also increases the volume of the thoracic cavity. We also have other thoracic muscles, including the scalenes, the sternocleidomastoid, and the pectoralis minor, that also participate during forced inhalation. Now, in a forced expiration, the thoracic cavity is compressed further by the contraction of the internal intercostal muscles, which are deep to the external intercostals. The respiratory volumes refer to the amount of air within the lungs during normal breathing movements or forced breathing movements. The volumes can vary according to each individual's body size, lung size, sex, physical fitness, age, and health. But we measure them in an effort to determine the relative health of the respiratory function. So let's go over these volumes. The first one we have right here is the tidal volume, which is the volume of air inhale or exhale in a normal breath under resting conditions. And this TV usually is 500 milliliters. The second one is the inspiratory reserve volume, or IRV, which is the volume of air that can be forcefully inhaled after a normal inspiration. And this is usually 3,100 milliliters. The third one is the expiratory reserve volume, or ERV, which is the volume of air that can be forcefully exhaled after a normal expiration. And this volume is typically 1200 milliliters. Number 4, it's vital capacity, or VC, which is the maximum volume of air that can be exhaled after a maximal force inspiration. And it can be calculated as VC equals TV plus IRV plus ERV. And the total amount is 4,800 milliliters. Next is the residual volume, or RV, which is the volume of air remaining in the lungs after a maximal expiration. And the residual volume normally is 1,200 milliliters. And lastly, we have the total lung capacity, or TLC, which is the total volume of the lungs, calculated as TLC equals TV plus IRV plus ERV plus RV. And this volume equals 6,000 milliliters. And in general, the respiratory volumes can be measured with a spirometer. So the waste product of cellular respiration is carbon dioxide, as you know. And this carbon dioxide needs to be eliminated from the blood. But if the expiration process were to fail, the accumulation of carbon dioxide in the blood would quickly exceed the blood's buffering capability, turning the blood to toxic levels of acidity. So here we're going to discuss the carbonic acid bicarbonate buffer system. And so this system of the blood helps to maintain the arterial blood pH at the levels of 7.35 to 7.45. When carbon dioxide diffuses into the blood, forming metabolizing cells, or from the metabolizing cells, I must say, most of it enters the red blood cells, where it combines with water to form carbonic acid. And this reaction can be written as it states here, number 1, water, carbon dioxide to carbonic acid. Then the carbonic acid formed in this reaction is short-lived. It quickly dissociates in water to form hydrogen ions and bicarbonate ions. Hydrogen and bicarbonate. And lastly, when the two reactions are combined, the formula for the formation of bicarbonate ions and hydrogen ions form carbon dioxide and water. It's as you see here. Water, carbon dioxide, carbonic acid, hydrogen ions, and bicarbonate. And if you enjoyed this video and you want to know more about this system, just click on the card on top of this video or wait at the very end so that you can observe or see the suggested videos. And that is it for today. Thank you for watching. Please don't forget to subscribe, like, and share. And if you have any comments, questions, or suggestions, feel free to comment on the comment section below. I feel like I said comment a lot, but anyways, you know what to do. Thank you for watching, and I'll see you on the next video. Bye.